Hi, everyone. Welcome to Will Therapy Services. I'm Teresa Will. I'm here today with Megan Clemmer. So we are a group therapy practice in Kitchener, Ontario. We support people of various ages all across the lifespan, supporting them with healing from trauma, as well as various mental health concerns. We actually have a new venture we're moving into, which is why we're here today. Because Megan, maybe have you introduce yourself and tell everyone that's watching today just a little bit about who you are and your experience.
Yeah, of course. Thanks, Teresa. I am Megan Clemmer, and I'm a registered social service worker. I have worked in the children's mental health field for about 20 years now, providing direct support to children, youth, and their families in the Waterloo region. Another passion of mine is running groups, and I've run a number of groups over the years, such as emotion management groups, anxiety, skill building groups. I'm also trained in the Connect program, which is an attachment-based parenting group, so provide that in the community, and then the mental health first aid training as well.
Yeah, we're very excited at Will Therapy Services to be moving into this new initiative, this new venture in providing mental health first aid training. Megan is actually our facilitator of the training. She went through the training a couple months ago and is feeling like we're moving into a place where we're ready to start offering this training in the community.
What is a mental health first aid training is an evidence-based training course that teaches participants about mental health and substance use challenges. It gives participants the knowledge and the skills to support others that they have noticed that may be struggling that are around them. So this can be used specifically within the workplace. This can be used within like family and friends. This can be used anywhere and actually can help recognize our own, decrease in our mental health well-being. Stats show that 1 in 3 Canadians are actually taking time off work as a result of mental health challenge, and 30% are of disability claims related to mental health, which is costing businesses a lot of money, right, when these are happening. So bringing in an initiative like Mental Health First Aid can really help address the impacts of mental health in the workplace as well, and reducing the stigma around mental health. When we do this, it shows employees that you care and that they're there to help and support. And the benefits to doing that can go on, and I can talk so much about it, but some things to notice, like the increase in morale when we're talking more about mental health, the retention of staff when they're feeling supported and can have that open dialogue, access direct supports within their company. Just initiating conversations and accessing folks the supports in the community can be a huge step, and it also increases engagement, just to name a few of them.
When it changes that emotional safety within a workplace and it changes, like you say, the morale, it increases the mental health literacy. It's a ripple effect of what happens, right? We have people not calling in sick to work because they're having, a kind of off day mental health wise, because they know their manager's there to support them.
The training is active in over 20 countries currently and developed by the Mental Health Commissions of Canada. It's a 1-day training certificate that can be done virtually or in person, and it has an adult learning focus, which is really great. Lots of opportunities to have discussions, small group activities, practice the skills taught, to be able to give the participants the confidence to use these skills outside of the training. This training is really easy to implement within the workplace, and it goes alongside nicely with already existing policies and procedures. So it's not like you have to reconfigure what's already within your policies and procedures within the workplace. It just coincides so nicely, and it's very easy to implement. Will Therapy Services is very active in the mental health community and has extensive experience in mental health. And we often support the most complex clients within our region. We often get referrals for those coming in. There's 5 of us here at the practice who have years and years of knowledge within the field. I truly believe that all the staff here are dedicated, they're trained, and they're compassionate and truly want to break down that stigma attached to mental health. so folks can feel supported with accessing the appropriate supports that they need in the community to help them when they're struggling.
Just to add to that, Megan, the thing that kind of stands out for me is that we're still in the field. You might have mentioned this, but we're still doing that work, right? So we're not going to move into a place where we're only providing mental health training in the community. We're still seeing clients, we're still seeing families, we're still seeing couples. We still provide that hands-on work. And so we really have a pulse on what's going on within the mental health field and kind of what the common trends are. What are we seeing? Supporting mental health in the workplace is not adding a burden to an already full plate. It's removing one that's taking up significant space on that plate. So thank you so much, Megan, for joining me today. I am super excited for the next step of what Will Therapy Services is hopefully going to be able to offer in our community. And I really, really appreciate your time. They can contact me directly at our practice phone number, which is 519-219-2034. Or they can email me at info@willtherapyservices.com. And I am more than happy to have a conversation about next steps and what this might look like in an organization.